How do you present new patient cases during clinical rotations? Imagine walking into a busy hospital ward and needing to quickly share a patient's story with your team. That's what presenting new patient cases is all about. It's a skill that helps everyone understand the patient's situation clearly and efficiently. During clinical rotations, you usually have about 5 to 10 minutes to do this. So, you want to be organized and precise. First, start with a quick introduction. Say the patient's initials or name, their age, gender, and relevant background. Then mention the main reason they came in. For example, Ms. Johnson is a 45-year-old woman admitted with severe abdominal pain. This sets the scene for your listeners. Next, state the chief complaint. This is what the patient reports as their main issue, like persistent cough or chest tightness. Keep it short and specific. Then move on to the history of present illness. Describe how the symptoms started, how long they've lasted, and any changes over time. Include details like what makes the symptoms better or worse. For example, the patient reports chest pain that started 2 days ago, sharp and radiating to the left arm, worsened with exertion, and relieved by rest. No nausea or sweating. After that, review the systems. This means asking about other symptoms in different parts of the body that might be related. For example, if the main issue is chest pain, you might ask about shortness of breath, dizziness, or fever. Mention both positive and negative findings. Then summarize the patient's past medical history. Include chronic illnesses, previous surgeries, or hospitalizations that could influence current care. For example, history of high blood pressure and diabetes. Follow with current medications and allergies. Be specific about drug names, doses, and any reactions. Don't forget the social and family history. Mention if the patient smokes, drinks alcohol, or has a family history of similar illnesses. This helps the team understand social factors that might affect treatment. Next, present the physical exam findings. Focus on vital signs like blood pressure, heart rate, temperature, and oxygen levels. Highlight any abnormal findings, especially those related to the main complaint. For example, blood pressure is elevated at 150/90, with crackles heard in the lungs. Then share relevant lab and imaging results. Summarize key tests like blood work, X-rays, or electrocardiograms. For example, troponin levels are elevated, supporting a diagnosis of heart attack. Finally, give your assessment and plan. List the main problems such as acute coronary syndrome and your reasoning. Outline what tests or treatments are next. For example, start aspirin and nitroglycerin, order an echocardiogram, and monitor cardiac enzymes. State your goals, like stabilizing the patient and confirming the diagnosis. Remember, keep your presentation clear and organized. Use simple language when explaining complex ideas. Practice beforehand so you can deliver it confidently. Tailor your details to the setting, more information for new admissions, less for daily updates. With time, presenting patient cases becomes a smooth process that helps your team make good decisions and provides better care.